Hello, this is Dr. Gay from First Look MRI, and this is a patient who's 64 years old. They injured their hand and they are unable to extend the fifth digit, so the surgeon knows for sure they do have an injury of that extensor digiti minimi tendon. And on this view here, we can see where it is. So this is a view, an axial T1 weighted sequence, and we can see right over here this foggy area. This is the extensor digiti minimi tendon where it should be. We see this fog. It's hard to tell if that's fluid or that's the tendon itself, but that is not normal. If we look over here, we see these other tendons that are nice and dark. We'll go out to the digits here. Here's towards the index finger, third, fourth. We're going to go into the digits, and you'll see this a little bit better. So as we get into the digits, here you can see second, third, fourth extensor tendons, and then the fifth one here we just don't see. So this is a ruptured extensor digiti minimi. And now we're going to try to look at some anatomy here, talk about a quick little point. So as we get into the digits, we do see a nice discrete extensor tendon. Remember that the extensor tendons of the index finger, there's two of them. There's the extensor indicis and the extensor digitorum. So there's two here, so it's kind of special. Actually, there's two over here as well to the thumb. And there's one here, and then one here, the extensor digiti minimi. So again, we see this one, see this one, see this one, and this one we don't see. It's ruptured. And now we're going to take a look on the T2 weighted sequences. Unfortunately, there's motion here, but we can see here we have two, the extensor indicis and extensor digitorum of the second digit here together, going to the index finger. There's two of them. Here's one to the third, here's one to the fourth, and then one to the fifth is actually right here. There it is right there. We're going to follow it. It ends over there. So this is ruptured and floating in the breeze and floating over these other ones, and there's a fluid in the extensor tendon sheath. So again, that is the ruptured extensor tendon. Now again, this is confusing as you get down into the hand because it looks like there's multiple tendons instead of just one at each level. That's because you have the extensor expansions. You have an aponeurotic type expansion that bridges these things together. You have obliquely crossing parts of that expansion where, let's say, the third and fourth will bridge together, and sometimes it can be hard to tell, like right here. There's a little foggy thing going across, and that's part of the extensor expansion between these third and fourth ones. And so again, it'll have a broad network that can be very, very confusing. But in this case, we do see that the extensor digiti minimi tendon is ruptured. It's right there. And again, it floats over here. And just remember the anatomy that you have two of them here, one here, one here, one here, and that this guy is special because the extensor digiti minimi comes off its own place in the wrist. So quick little thing here, if we go down to the wrist, we'll have the extensor digitorum and the indicis all in this one compartment here. And then there's another compartment, and all by itself we have the extensor digiti minimi, so it's a little bit special, and that's the one that's ruptured. And if you're wondering, what are these guys over here? These are the extensor carpi radialis longus and brevis tendons. If you remember from other videos, and there's a little thing over the top of that, the extensor pollicis longus. It comes obliquely over the top, and it comes over here to the thumb to join the brevis. So there's two to the thumb, two to the index finger, and then we find those, there they are, and then one for the other one. So thank you very much.